What is stress overload and its symptoms? When the stress level is high for us to cope with our skills and it adversely affects what we do, we call it stress overload. It affects body, mind, and behavior. But people's experience will be different. When the stress is overload level, there are three main responses. These are feeling of anger and agitation. People feel very emotional and find it difficult to stay still. Withdrawal response. People shut down, have lack of energy, and focus to do something. Both angry and frozen response. People feel like frozen under stress and it seems that they can't do anything. At the same time, people feel agitated. Stress overload have a variety of symptoms. Cognitive symptoms, emotional symptoms, physical symptoms, and behavioral symptoms. Cognitive symptoms include difficulty in remembering, concentration issues, anxious and negative thoughts. Emotional symptoms include being irritable, agitation, and unable to relax, feeling loneliness, general feeling of depressed, and sudden changes in mood. Physical symptoms include chest pain, increased heart rate, needing breath of air, diarrhea or constipation, increased muscle tonus, general body ache, decrease in libido, and sweating. Behavioral symptoms include changing sleeping and eating. They could increase or decrease. Self-isolation, postponing or neglecting your responsibilities, using alcohol, cigarettes, and other recreational drugs to relax. If you recognize and acknowledge these kind of symptoms, you can take precautions. Some of these symptoms can be seen other psychological and physical illnesses. That's why it would be better to talk to a doctor or a specialist in persistent symptoms. Effect of stress. Constant stress is linked with various mental and physical disorders. Stress is shown to suppress immune system, resulting in infectious diseases, herpes zoster, cancer, autoimmune diseases like rheumatoid arthritis and multiple sclerosis. Think of when you have common cold and related infections. There is a chance that at that time you would be tired, sleeping less, and probably under stress. Stress and leading a stressful life is one of the main reasons of heart disease, heart attacks, arrhythmias, stroke, increased blood pressure, and angina pectoris. Ulcers over the skin or inner surfaces of organs like intestines are commonly associated with increased stress. In the list below, you could see 50 effects of stress. If you look at them closely, you could see that from head to toe, stress affects every part of body, physically and mentally. We don't think this long list of effects very often. We come to realize them when we have health problems. This is not to say that giving a public speech occasionally and feeling stressful, but if any kind of public speaking, either in front of smaller or big group, is causing you to have anxiety, regularly you must think whether stress is playing part in other aspects of your daily life. Stressors and how they make you respond to them varies from person to person. A person must be aware of the stressors. What makes them anxious? If we identify the cause, we can work on them to reduce their stressful effects. We can develop new skills to cope better. If you postpone your duties or let's say your homework until the deadline, it's more likely to cause you anxiety, insomnia, irritability, and even your eating habits. In an example like this, planning in advance and doing your duties and homework according to your timetable will ease the stress. In case of public speaking, there should be enough time to prepare for your speech. Number of days passes very quickly. Don't leave until the last days to prepare. If that comes, stress load kicks in and you couldn't do what would be easy task for you to complete in that period. Preparations is the key in giving successful public speech with reduced stress and related side effects. Most common symptoms of stress: frequent headaches, jaw clenching or pain, gritting, grinding your teeth, stuttering or stammering, tremors, trembling of lips and hands, neck ache, back pain, muscle spasms, lightheadedness, faintness, dizziness, ringing in the ears, frequent blushing and sweating, dry mouth, problems with swallowing, cold or sweaty hands, feet, frequent colds and infections, rashes, itching, hives, even goosebumps, unexplained or frequent allergy attacks, heartburn, stomach pain, nausea, excess belching and flatulence, constipation, diarrhea, difficulty breathing and sighing, sudden attacks of panic, chest pain, palpitations, frequent urination, low sexual drive or performance, excess anxiety, worry, guilt, nervousness, increased anger, frustration, hostility, depression, frequent or intense mood swings, increased or decreased appetite, changes in sleep, insomnia, nightmares, disturbing dreams, difficulty concentrating, racing thoughts, trouble learning new information, forgetfulness, disorganization, confusion, difficulty in making decisions, feeling overwhelmed, frequent crying spells or suicidal thoughts, feeling of loneliness or worthlessness, little interest in appearance, punctuality, nervous habits, feet tapping, fidgeting, increased frustration and irritability, overreaction to petty annoyances, increased number of minor accidents, obsessive compulsive behaviors, reduced work and hence reduced productivity, lies or excuses to cover up poor work, rapid or mumbled speech, excessive defensiveness or suspiciousness, problems with communication, social withdrawal or isolation, constant tiredness, weakness, feeling fatigued, frequent use of over-the-counter drugs, weight gain or loss without a diet program, increased smoking, alcohol and drug use, excessive gambling or impulsive buying. How to assess stress? As we have said from the beginning, stress is part of life, and when it's in small, manageable chunks, it even increases productivity and it may be exciting at times. But when stress becomes constant and starts affecting health, it needs to be evaluated. We need to ask questions to assess stress. These questions would be: what happens in your body when you feel stressed? When things become difficult and disturbs you, what changes in your body, thoughts and feelings? Does your behavior change under stress? What's your positive and negative reaction to stress? What are your coping strategies with stress? These questions will give an idea about the level of stress one is under. To use it for an assessment, and the following questions may be asked. Do you feel sorry about being angry or short-tempered with others? Do you use tobacco, alcoholic drinks, or medications, even prescription or over-the-counter, to deal with stress? Do you have problems with sleeping? It could be lack of sleep or oversleeping. Do you lose control because of stress? Do you lately laugh or smile less than your normal? Does your behaviors include yelling, crying, and isolation yourself, especially lately? Feel unhappy, upset, and worried? Do you have changes in your eating habits, like eating too much or less under stress? Do you have lost control of your life? Do you have difficulty letting go of things that bother you? Do you think that things rarely go right, and do you blame yourself for them? After answering these questions with often, sometimes, and rarely, count your scores. If you have answered often or sometimes more than 4 times, that indicates you need to do something to cope with your stress. Daily Hassle Scale, developed by Lazarus and Folkman in 1984, is one of the best methods to study long-term stress. The examples of stressors in this scale are from our daily lives, like finding a parking spot or difficult colleagues at workplace. Different people will perceive the same events as distressing or threatening. People's beliefs, experiences, culture, knowledge, attitude, and values determine their perception. In a hypothetical exam situation, when one of the students finishes his or her exams early and leaves the room, student A, who sees and thinks that Jane Doe has finished her exam early, she must have done very well. She is cleverer than me. I'm not going to finish mine. I have already disastrous scores from my exams. Under these thoughts, her performance is affected out of her control. On the other hand, student B in the same room thinks that Jane Doe has finished her exam 20 minutes early. She must have run out of things to write or answer. She is behaving stupidly by leaving early. I still have plenty of time and I could try for another round for the difficult questions. As in this example, same situation is perceived threatening by student A, and B sees the same situation positively and giving B more encouragement to do better. For reflection, make a list of your stressors in your life. What are your coping strategies or mechanisms for managing your stressors? Rank your coping strategies according to effectiveness.